a little bit more informative than MRIs to tell me if there's bone turnover in a knee. That aside, let's say I have somebody that I do think their pain is from arthritis and they do need to tackle that pain. I usually start them with the Joint Health Multi in the morning because it has those curcuminoids and the ginger like we talked about. It also has a little bit of PEA and some black pepper. Take that in the morning, and I usually tell people tart cherry extract at night. Why? Because most of those pigmented fruits that will give you the flavonoids and the polyphenols or the plant chemicals that reduce inflammation also have melatonin. The last thing you want to do is take melatonin in the morning. You really only want that in the evening. So naturally during the day, your cortisol should spike in the morning, then drop. And during the day, your melatonin should spike in the evening and drop. So it should be like this. If you take melatonin in the morning, you're going to screw that up. So Joint Health Multi in the morning, tart cherry at night. The omega-3s, AM or PM, whatever works best for you. Hint, when you open omega-3s, however you get it, put it in the fridge. Because it is fish oil can go rancid. So I put it in the fridge is dark and cold. You don't want UV rays hitting it. Ours comes in a dark container for that reason, to block the UV rays. And then of course the B complex, which is really mandatory for all situations in the body, but a lot of people forget about it when they're trying to treat their pain. So connective tissue pain or general immune health, my very first supplement that I came up with to help my patients recover from surgery was the connective tissue multi, because it has calcium, magnesium, zinc, C, and then you can get one with CBD or with PEA. Both are gonna go to the endocannabinoid system, right? But some people don't want CBD, so they get the one with PEA. They're both equally effective in reducing pain a little bit, but for the basic fundamental building blocks like D3 that you need for your immune system, you need to have this multi as just a go-to everyday take it, because you don't have to, but you really need it. Most of us are magnesium deficient, so this will replenish that magnesium every day too, as well as give you the zinc you need to function and fight off disease, infection, and to heal injury. Glycine, again, for connective tissue, it is every third position in the collagen bundle in terms of amino acids, hugely important. Glycine also counteracts the effects of glutamate. Glutamate is an excitatory neurotransmitter. Glycine is a calming neurotransmitter. So glycine has a dual function. Omega-3s, better cell membranes, more flexible cell membranes, far less inflammation. And coincidentally, your triglycerides will drop. Again, all of these things have great health benefits besides making you feel better, as opposed to the synthetic drugs that have side effects that make you worse and may or may not help you feel better. Tart cherry, we talked about. Joint Health Multi, we talked about. So that's the stack if you think you're more of a connective tissue player versus a pure arthritis player. And your doctor can help you determine this, or if you come see me, I can. And then oxidative stress. Again, just to refresh, and we did a whole talk on this before, this is the reactive oxygen species that are the byproduct of energy production in the mitochondria, okay? And also the byproduct of pollution, toxins that we take in, things like that, okay? Radiation, sun radiation, whatever.